My name is Taylor Harris. I'm one of the sports medicine surgeons at EmergeOrtho. I specialize in multiple different extremities, but in particular today we'll be talking about elbow injuries, which are common in throwing athletes. Specifically today we'll be covering the ulnar collateral ligament. The ulnar collateral ligament is the main stabilizer on the inside of the elbow. In particular, with throwing sports or contact sports, it resists a valgus load to the inside of the elbow. If it is torn or partially torn, it can cause instability and pain. Ulnar collateral ligament injuries we commonly see in throwing athletes. This would usually be your baseball and softball players, but other sports such as football with quarterbacks or track and field athletes participating in javelin, these can also be seen. In particular, we are seeing a rise in ulnar collateral ligament injuries in the young athlete, in particular those participating in both baseball and softball. This largely is due to year-round play, pitch counts, and overuse injuries. Typically, an athlete sometimes describes a pop. This is pain that is felt on the inside of the elbow. They occasionally remember a specific pitch or an inning. Other times it's more chronic overuse, where over time they notice a drop in velocity or accuracy that often leads to this diagnosis. Other than the pop and pain to the inside of the elbow, occasionally patients will describe numbness and tingling from a nerve standpoint as the ulnar nerve runs close to where the injury occurs. This oftentimes leads to these symptoms in the ring and pinky fingers. Typically, ulnar collateral ligament injuries occur in a chronic overuse setting. Again, this would be more common in sports such as baseball or softball. Occasionally, they can be more traumatic, which would be your contact sports such as football with quarterbacks, or even things such as diving or throwing the javelin. Typically speaking, the initial evaluation starts with a detailed history and physical, followed by imaging. Oftentimes, the history and physical can lead to suspicion, with x-rays first showing various bony abnormalities that can lead to these injuries, with MRI oftentimes requiring contrast from an arthrogram standpoint, confirming the diagnosis. Non-surgical and surgical options are typically used for ulnar collateral injuries. Starting with the conservative non-operative route, this would be a period of throwing cessation followed by physical therapy, which would deal with dual as well as single-handed plyometrics, followed by a gradual interval return to throwing program. Oftentimes these are for younger patients or partial thickness, low-grade tears, and can get patients back to throwing and participating in their sport in roughly 3.5 to 4 months. The other route would be operative, which certainly is reserved for high demand older athletes or those who have failed the previously mentioned conservative measures. The types of operative interventions include traditional, what you maybe have heard of as Tommy John surgery, where we perform a reconstruction using some of the patient's tissue to create a new ligament, or the new UCL repair with an internal brace, which has been popularized over the last decade and sped up the return to sport for multiple athletes. Recovery can vary depending on what needs to be done. Again, as we mentioned before, a reconstruction or a repair with an internal brace are the two most common surgical options. Typically, the repair with the internal brace is performed when the tissue is adequate, so just the type of injury and the quality of the tissue are amenable to this, which is favorable from a return to sport standpoint, which averages between 6 and 9 months. Traditional Tommy John surgery ranges anywhere between 12 and 18 months, so if it's right for the patient and their injury, certainly the brace is becoming the initial standard of care. One of the most popular topics is prevention of ulnar collateral ligament injuries. As we mentioned earlier, this is unfortunately becoming something we're seeing in younger and younger patients at an alarming rate. One of the things to prevent this is to try to eliminate the overuse injury. Something I always suggest is for kids really until midway or towards the end of high school to have multiple sports and not just participate in one. This oftentimes can help prevent the overuse throwing injuries with year-round baseball or softball. The other thing that coaches can do is specifically look at pitch counts and days of rest in between starts, which can help limit the overuse. And lastly, a lot of the preventative is from a biomechanical standpoint, from physical therapy and strengthening the muscles and mechanics so that the elbow is not taking any added stress that it doesn't need. Overall, I think one of the larger points to take home for ulnar collateral ligament injuries is the preventative aspect, and that's the things we previously mentioned of avoiding the overuse that leads to these injuries. But if the injuries do occur, I think it's important to come to a place like EmergeOrtho where the newest and greatest techniques such as ulnar collateral ligament repairs with internal braces are offered, as well as the more traditional Tommy Johns or ulnar collateral ligament reconstructions, depending on what's best for the patient.